So welcome for those of you who have joined us. My first question for everybody. How do I do that?
If you put that up there, go to that just.
Okay.
He was complaining that he
Okay.
seeing you.
Okay. Thanks. My technical guy, this is Word. If you're here for the first time, would you raise your hand? Okay. I'm not married. Okay. For those of you who don't know me, my name is Tony Variant. I am a hearing loss resource specialist, and the leader of this chapter. I've been in a volunteer role since the Hearing Loss Association of America was once called Self-Help for Hard of Hearing People back in the 70s. And I've been in this role for 25 years. With the exception, I did work for Self-Help for Hard of Hearing People for 9 years, and I lived in the Washington, D.C. area. And then I retired back to Orange County, and here I am. I've been volunteering ever since. So I am a person with a hearing loss. I have a cochlear implant, and I have a hearing aid. So I totally relate. Okay. Totally relate to people who are, thank you, that have cochlear implants and hearing aids. To tell you the truth, with the cochlear implant and the hearing aid, life is still difficult. Life is not perfect. I don't hear normally, even with all my assistance. But when I get support from you, when we start chatting about hearing loss and the difficulties we have in the day, I feel that you're supporting me, and I am here to support you. So we are all part of the hearing loss community, and the way that we help each other is to participate in these meetings. HLAA Mission Viejo Chapter, we don't endorse any single product or service, and this meeting is intended to provide information, education, and support. Now, we survive by donations, and Jeff, if you would, we're going to pass the hat, so to speak, the basket, and ask for contributions. We don't ask a fee to attend meetings, and we don't have a membership fee. Just by virtue of coming to a meeting, I just consider you a member. Okay. I want to make some announcements. The new people need to learn about hearing loops. And I am really good about teaching about hearing loops. Most of the clubhouses, I should say all of the clubhouses, this is a handout that's available on the table here. All of them now have a hearing loop. The installations for Clubhouse 1 and Clubhouse 5 are complete. So if you have t-coil equipped hearing aids, all you need to do is to go into the room, and when the presenter is talking, switch to telecoil, and you will hear them as if they were sitting in your ear with no background noise. It's wonderful. So I've been working on getting hearing loops in Laguna Woods since 2015. I'm not done. I think that resident services needs to have a loop. It's really noisy when you go to get help and everybody's talking. So I'm going to work on that. So I'm not done getting loops in Laguna Woods, but please pick this up and visit our website, HLAAMV.org, and learn about hearing loops. There's information about hearing loops, 2 or 3 pieces on the table over here. Okay. And if you're in the process of buying hearing aids, or if you have a cochlear implant, be sure and get a telecoil. Ask your provider to make sure you have a telecoil. That's the way that it works. Almost very simply, you just flip a switch. You don't have to wear anything, borrow a receiver. If you don't have hearing aids and you don't have a telecoil, there is something called a loop receiver, and they're at the sign-in desk down there if you want to borrow one. So, and that way you can hear my voice directly in your ears. Do you know, with your cochlear implant, do you know if you have a telecoil? Yeah. Oh, I thought you did. Oh, Dot was here and left. Okay. Sorry. Okay. All right. I want to tell you, before we move on, I want to tell you about March's meeting. We're going to have an esteemed physician, Dr. Mahabui, from the House Ear Clinic. He is going to be talking about sudden hearing loss and why it is an emergency. You can have hearing loss and then have sudden hearing loss on top of that. Or if you know somebody who wakes up one morning and suddenly doesn't have hearing loss, that's an emergency. And he's going to talk about what you need to do and when to do it and how to get help to see if your hearing loss can be reversed and preserve your hearing. It's really important. He's also going to be available to answer any other questions after we're talking about sudden hearing loss, that you would ask an ear doctor, an ENT, an otolaryngologist. So he's coming next month. Okay. This is the first time I've ever mentioned this in a meeting, but we need volunteers. And we need volunteers. I have a vacancy for our secretary position. Take notes at our planning meetings. I need help with technical support, setting up the meetings. There's 2 computers, one over here, and then there's the one we use here for our Zoom and our projecting our PowerPoints. Need help with graphics, need help with publicity, need help assistant with refreshments, mailing list maintenance, and help with fundraising and advocacy projects. Because you see, I want to grow the hearing loss community. I want to make people aware of hearing loss, but I cannot do it by myself. So I need volunteers that are willing to work, maybe 5 hours a month, get together, have a meeting, and stir up ideas, and then go get them, so to speak. All right. And training is provided. Okay. So today's topic is navigating health insurance and for hearing aids. And we're going to cover a lot of things, even more than what I had said. And how many people are in the room have insurance that covers hearing aids? Okay, a lot of you do. How many people have actually purchased a hearing aid through one of those health plans? Okay, very good. And how many of you have either Medi-Cal or a Medicare Advantage plan? Okay, very good. So I want to talk a little bit about who covers hearing aids. And that was a very difficult project for me to cover. because it's not that obvious. And you can't talk to any insurance companies directly. You have to talk to a broker. All right, here's my information. So just about every Medicare Advantage plan has some coverage for hearing aids, but not all of them. Some of them only cover a hearing test. And some of them cover the hearing exam. Some of them cover a fitting. And they have a copay. And the copays, I can't believe how much they vary from plan to plan. It's impossible for me to tell you every plan and every copay. And of course, the copay is going to make a difference whether you get an in the ear, behind the ear, what style hearing aid you get and what features you get. Some Medicare Advantage plans, mostly not, but some will cover over-the-counter hearing aids, which I was surprised to discover. So here's some ranges. So scan, Medicare Advantage, you must go to your primary care physician and get a referral to see the in-network hearing aid provider. And scan one of their plans. They have several. They cover between $450 to $750 per hearing aid. That's a copay. They don't cover over-the-counter aids. Blue Shield has several plans. Again, you must be in-network, referral from your primary care physician, and there's no copay for the hearing test and for the fitting. And depending on the hearing aid, it could be $449 to $699 per hearing aid. And with all of this, I'm telling you, limits apply. So it's really hard to figure out. And Blue Cross or Blue Shield, by the way, has several Medicare Advantage plans right here in Orange County. And all of them are a little different. Here's another Blue Shield plan. They don't cover the fitting. They only cover the hearing exam, and they don't cover prescription aids. So with all the research I did, I thought, my goodness, how am I going to boil this down for you guys? Well, let's see. Is Beatrice here? Oh, okay. So there's a lady that I'm going to have. She's not here right now. She's supposed to be here. Here's some other insurance information that I got. Aetna provides $2,000 each per ear, but I don't know what plan. And Aetna has several plans. Blue Shield, I already mentioned that. Humana covers it. Scan, I told you about that. United Healthcare, looks like they have pretty good, anywhere from $99 to $1,200 per ear, per year. But it is limited in the sense that you must go to their provider, stay in network. And that's a mistake I don't want anybody to make. So because I had so much difficulty with trying to boil this down for you and with all the different plans, Beatrice, who will be here, is with the Council of Aging here in Orange County. And she is a supervisor for HICAP. So HICAP is a free counseling service the Council on Aging, and they're nonprofit. They don't try to sell you anything. It was very helpful for me when I was exploring the best Medicare Advantage plan with prescriptions. And so my prescription's pretty expensive. So they were able to go through and find the best Medicare Advantage plan for me. So they could find the best hearing aid cost for you. So, and as soon as she arrives, I'm going to scuttle her little rear end up here and have her talk to you about HICAP and how to make an appointment and the kind of service you get. Okay. And hopefully she will. So, then I'm going to have you talk to AJ Catarucci. He's with the CQ Partners, and he's well versed on third-party providers like Medicare Advantage. So he can talk to you a little bit about that. But next, we're going to have Ann Mundell Noel. I've asked her to come and talk to you because one time we were talking and she told me a little history about Medicare and their relationship with audiologists. And actually it's changed kind of back and forth a little bit. So, Ann, would you come on up here? Ann is also for 13 years, Ann has been the audiology advisor for our club. 13 years. I looked it up since 2015. So, well, actually that's 10 years. 13. No, it was 13. I was here 2 years, met you, and then you joined in as the audiology advisor. And she has helped immensely with helping me get presenters, and she's presented herself, and she comes and answers your questions. And there's no charge for that. So you get to talk to an audiologist and get some free advice. So Ann, why don't you come on over here and talk to us? No. Talk to us a little bit about
Medicare. Good afternoon. How we doing? Get the wiggles out, get some energy going. When I talk to Tony about Medicare and audiology, I want you to know I have a master's degree in hearing sciences. So as an audiologist, I have an undergraduate degree in speech pathology and audiology, and then my master's degree is in audiology. After I did my master's degree, I then had 1 year of what's called a clinical fellowship year. It's a year where you study under somebody, and then after that, you can start to practice. In 2007, okay, so we're looking at 17 years ago, our profession changed from a master's degree to a doctorate degree. So what does that mean? It means that now Dr. Gabby, who works at my office, she has 8 years of college education in hearing sciences. So she's got a 4-year undergraduate degree in speech pathology and audiology, and then she had to go 4 more years in hearing sciences in order to get her degree. A lot of schooling. Her 4 years does include the clinical fellowship year that I did. So she basically has 1 more year of schooling than I had back in the 80s. What they include now is things for cochlear implants, interoperative monitoring, and some other things that as a audiologist who dispenses hearing aids, I did not need that education because I wasn't going to go into an operating room. So in 2007, when the degree changed from a master's degree to a doctorate degree, I was grandfathered or grandmothered in. Okay. So I had the opportunity to either go and get my doctorate degree or to just be grandfathered in and keep my master's degree title. At the time that that happened, I was retired from the profession. Was raising my kids, and so I didn't feel I needed the doctorate degree. But I want you to understand that today's audiologists have a doctorate degree. So why? Why would we as a profession change from a master's degree to a doctorate degree? Because as a profession, we wanted Medicare to recognize us as an LLP, a limited licensed professional, like a dentist, like a chiropractor, that Medicare would see us as not an MD, but a doctor in our own profession. And with 8 years of college in hearing sciences, we should kind of know when we're supposed to refer to a medical doctor for medicine or infection. It has been 17 years and it hasn't budged. 17 years. Yes, there's a couple little things that Medicare does now that I'll talk about, but in general, again, we changed our whole, our whole profession from a master's degree to a doctorate degree. We had less universities that offered the program. They had to change their curriculum because we were hoping to be able to have Medicare pay for hearing testing and to pay for hearing aids. Zero. Medicare now pays for a cochlear implant. 10, maybe 15 years ago, Tony, maybe, Medicare didn't even pay for a cochlear implant. Now they pay for a cochlear implant. And why is that? Because it's done by an ENT. It's done by a medical doctor. So he's under the American Medical Association, and so now they pay for a cochlear implant. But they don't pay for all the therapy on the back end of a cochlear implant that's done by an audiologist. That's all included into one big lump sum, but they don't pay for ongoing therapy. So why do I tell you this? I want you to know that Medicare purse strings have been held by the American Medical Association. And because of that, that is why the Medicare Advantage plans have come out. The Advantage plans are not Medicare. What they are is they are a supplement to Medicare because they want to get your Medicare benefit. So they're willing to give away a little dental, a little vision, a little hearing so that you can kind of get a discount on those programs, and then they will get your lion's share of your Medicare costs. Does that make sense? So Medicare, your supplement plans that you have for this hearing aid coverage, as much trouble as Tony had trying to find out the information, our office has tripled the amount. If we were to try to figure out your plans, one person says you have this, one person says you have that. We've had a patient come in and we've gotten 3 different answers from them. So it's a very nebulous area that just is very confusing. I think they make it confusing on purpose. But I just wanted you to know the history of Medicare, how it's influenced our profession, and how, as an audiologist, our office chooses not to be a Medicare provider because of all the constraints that they have on us as a profession. So that kind of gives you a little bit of a snippet. Does anybody have any questions for me? Yes, sir. You want to take on my microphone?
Okay, thank you.
the insurance company in the past considered hearing aids cosmetic nature. And have they changed their thoughts about that?
As far as a hearing aid being cosmetic, I don't know which insurance company you're talking about. They used to put it under durable medical equipment. So when you had an insurance benefit, it got put under durable medical equipment. Now, such few insurance companies really pay for hearing aids, less than about 5%. I don't know if we know it's not cosmetic,
Yeah.
but I don't know how the insurance company, I haven't heard that recently.
So they really haven't been educated themselves about the hearing loss population.
So what we know about hearing loss is that if you don't treat it, it can lead to cognition decline, it can lead to memory loss, it can lead to balance issues, falls, all those things that hearing aids help. But yes, the insurance company is still Medicare is still holding the purse strings on getting the benefit to the people. We would love to have Medicare pay for hearing aids, but right now that's not where we're at.
I do recall that there have been some legislators in Congress who have tried to get, and the Hearing Loss Association, California Association was working, to get more people interested. Write your congressman and twice in a row. Anyway, that's not been successful. So to get hearing aid coverage.
Even in the past, for a hearing test through Medicare, if you had a medical condition, you had an ear infection, something that you got hit to the head and the bones were misarticulated and you needed surgery, Medicare would pay for a physician to be involved. But if you had a hearing test just due to presbycusis, which is normal aging, they would not pay for it. Well, how do you know if you have a hearing loss unless you do a hearing test? I mean, that's kind of how silly Medicare has become. But again, the American Medical Association is so strong that they don't want to give up their $65 office visit. And so they want you to come to them, and then you have to get referred on.
So we had somebody that, I'm going to come over here. She already told me that she had gotten hearing aids through insurance, and Allison, yes. And the reason why we need to use the microphone is the woman who is captioning for us. She's in Chicago, Illinois. In order for her to hear over the internet, we have to use the microphone. So.
Yes, I have Kaiser, and I have a benefit that I get this benefit every 3 years. But I have to use their provider. And I'm not crazy about the provider. So what I've done is gone outside to get some of the ongoing
Care.
service that I feel like I want to feel really confident that I'm getting the best. So I'm willing to pay for that.
So if you went to Kaiser, you probably got referred to Hear USA.
Yes,
Yeah,
correct.
because Kaiser owns Hear USA.
Oh, okay.
Again, little things that we don't know, but there's a reason that they do that. And you probably got a Signia hearing aid because that's the hearing aids that Kaiser works with. So there's a reason that things happen the way they do. And I know that AJ will talk a little bit more about it, but the problem is that the patient in these Medicare Advantage plans are the ones who get the limited service. And then we as a provider have the purse strings, pulled back on us for the limited care. And that's where the problem runs.
Right.
Anybody else?
Anybody else have an insurance experience with hearing aids?
You got one up here, Tony.
Well, I also have Kaiser, but I am satisfied with the care. And I have both Kaiser Medicare Advantage, and then I have a separate policy with Kaiser. It's like $20 a month that covers hearing, eyesight, and dental. And I have Widex hearing aids, but I think my benefit was $1,000 per hearing aid. But I feel they do take good care of me.
Well, the fact that you got a Widex hearing aid from Hear USA is kind of unheard of. Are you from Northern California? No?
I just wanted to say that the first time I got hearing aids, I got what they gave me, the Cigna or whatever it was.
Signia?
Yeah, Siemens at the time. But by the time I went around for the second hearing aid, I picked my own, so I got an Oticon that time. But anyway, so I was able to get something else.
Mm-hmm.
Yeah.
Good.
I'm going to look and see if anybody on.
I think she had a question. Tony, she had a question.
Oh, sorry.
Next to Ken.
Well, I have a problem right now. I need to get new hearing aids. And I have Oticon hearing aids. I'm with United Healthcare. And it seems a little complicated. And I don't think that they will pay anything for Oticon. I think that they have a very small
Yep,
maybe-
so AJ can address that. He's saying he can address that and he can talk about that.
Super. Glad someone's here to help.
Tony, are
Because
you
I
ready
lost
for AJ
one.
to maybe talk?
I lost one and I need to have them replaced.
Okay, I just got a text from Beatrice. And she said that her appointment with me did not get saved in her calendar. And she's in the office and won't make it. I can't tell you how disappointed I am. Okay. So this is AJ, yes. Oh,
Hi, everyone.
Okay.
I've got some slides here.
Let me get yours.
with some information for you. But before we get into that, my name's AJ Catarucci. I'm an account manager with a company called CQ Partners. We support private practice owners in audiology, like Ann over here, and really just help them on the business side of their practice. I'm not an audiologist. I don't pretend to be one, but I know a lot about business. I know a lot about training, and I have really been studying insurance because it's very complicated. It's confusing to me. I can't imagine how confusing it is to everyone else. So I am just going to talk to you a little bit about what I've learned and explain a little bit to you and the viewpoint from the private practice audiologist, what they're seeing on their end when working with insurance companies too.
Technical.
There we go. All right, perfect. So we're going to talk first about, just explaining what the difference is between a true benefit and what we refer to as a third-party administrator. But I had some questions for you up front. Do you want to invest a little more money to be in control of your healthcare decisions, receive the best care and the best results possible? Or do you want to let the insurance companies dictate the care you receive and the devices that are available to you? What's everyone think? Would you rather be in control of your own healthcare or let the insurance companies? Yeah, agreed. So we're going to talk a little bit about third-party administrators. Does anybody know what that is? Have you heard of what's called a third party? Has anybody worked with True Hearing, Hearing Care Solutions? You brought up United Healthcare. So they have United Healthcare Hearing. So first and foremost, Medicare does not pay for hearing aids. Instead, what we're seeing is in recent years, insurance companies, they've outsourced their hearing healthcare benefits to what's called a third-party administrator. The third-party administrators then take care of all the benefits for you, and you purchase hearing aids directly from the third-party administrator. So you might think it's a benefit, but in reality, it's a discount plan. And again, you know, if I'm sorry, what was your name again? Ken up here. Ken and I were talking before we got started. He works with some third parties. So what they do, like True Hearing would contract with Ken. If your insurance works with True Hearing, if they manage your hearing healthcare, they would then refer you over to Ken. Ken would do the testing, the fitting, and you'd purchase those hearing aids directly from True Hearing, and they would pay Ken a dispensing fee for his time. True Hearing would then dictate the brand that you get, the models offered, and they'll restrict patients from office visits to just the evaluation, the fitting, and 2 to 3 follow-up visits over the next year. After that, you're stuck paying out of pocket for visits. Has anyone experienced that? After your first year's up, then you have to pay out of pocket? Okay. So that's, if you're to work with a third-party administrator, that's what happens. Here's why hearing healthcare providers are moving away from third party. So when I work with providers, the idea is they have a standard of care that they want to meet. They provide not just the hearing aids, but there's a lot that goes into it. They want to get you, to where those are working optimally for you, and that requires several follow-up visits, repairs, cleanings, annual evaluations to make sure your current prescription's meeting your needs. So there's a lot that goes into it to really dial that in. And when you work with a third party, they tell the provider, this is what you can do for that patient. They don't let you provide, exactly what that patient needs. And providers, they want to provide you with that gold standard patient experience. And patients don't get that when they go through a third party. So, providers are moving away from that because of that. Providers want to give you access to the best brands, the best models that are available to you, and what will work for you best. And when you go through a third party, your True Hearings, United Healthcare Hearing. United Healthcare Hearing is going to tell you what model that you get and what brand that you get. And you will get 1 year of service, limited follow-ups, you'll get the fitting, and after that, you'll be paying out of pocket. And here's another big reason, like me coming from like the business side of this, is reimbursements from third party. So paying the provider time to work with you to get you the care you receive, they are very low, and they shrink and shrink and shrink. And so it doesn't make sense for providers to continue to give you 3 years of service when they're not being paid for it. So it makes it harder and harder for them to continue to provide care to the community, because the reimbursements on these are so low. So instead, they work with you and give you the opportunity to purchase what's called a private pay sale, where you invest and you purchase directly from that clinic. So I wanted to show you a little bit here. So this is what a treatment plan would look like. And as you can see, there's a lot of different things that go into really dialing in your hearing healthcare. You've got annual hearing screenings. You got Bluetooth troubleshooting. Make sure it's connecting to your phone. You've got repairs. You've got rechargeable batteries. So when you make a purchase directly from the clinic, you're getting all of this. And this is not what they're giving you when you go through a third party. It's very limited. So when you're talking to a provider about your options, you want to make sure to ask these types of questions. What comes along with the device? What does my treatment plan look like? And make sure you're well versed in that and you understand what you're truly getting, and ask what you would get when you go through the provider directly. Again, do you want to invest a little bit more to get the treatment that you want, the devices that you need, and the best results possible? Or do you want to let the insurance companies dictate the care you receive and the devices that are available to you? Any questions? It's a very complicated situation, and it's hard to monitor, and that's why we're here to see if we can help you. Yes.
I have a question too. So we were talking about Kaiser and the fact that Kaiser works with Hear USA, and mentioned that Kaiser actually owns Hear USA. So is that considered a third-party administrator, or is that pure Kaiser?
It's
Yeah,
Kaiser.
so I think that would not fit within your scenario in terms of talking about that as a TPA.
It's a little bit different. It still fits within the same realm, though, because when you go to Kaiser, you're still limited on, as far as I know, you're limited on the devices that are available to you and the treatment plan options and how much you can pay more out of pocket to get a better treatment plan there. But then it becomes apples to apples with what going somewhere that just only takes private pay.
My treatment plan does have coverage for after a first year. I can go to them
Right. So
for free.
Right. So what happens with Kaiser is, let's say you paid out of pocket $2,000 per hearing aid. Okay. You still paid out of pocket $4,000 for hearing aids. The question is the hearing aids that you got for that $4,000 a better quality? Could you have gotten something of a little bit better quality than what you was prescribed through Kaiser? And like I said, she started out with Signia and then went to Oticon. So, yeah, so what I'm saying is, can you stay within the Kaiser system? Yes. But could you, our whole thing is that, can you take your private pay dollars and get something of a better quality and better service than thinking you're getting a discount through your third-party administrator? Because when you go through the third party, like AJ said, they send us the hearing aids. If you have a repair, it goes through them. We are not responsible to know when the hearing aids are coming in or out. We can't control that because it's all done through them. I'm sure Ken's probably got some stories about that as well, because you do a lot more with the third party and we choose not to. Because if I were to stay and do third party administrators without private pay, I would go bankrupt. I couldn't stay in business because the quality of care that we offer, I won't give through a third party. I couldn't stay in business.
It's a great question, though.
I have. Are we done with this slide? Are
Yeah.
you done with your slides?
Yeah.
Because we have some questions coming in from the participants online. I want to be able to get to that. So Kenneth Peters, do you want to read these here? I want to read it up. Kenneth Peters says, I don't think physicians, AMA, are to blame for Medicare not covering hearing aids. Medicare does not want to take on expensive hearing aids. Got it. Stuart says, I have fantastic insurance, had benefits and much more for myself and my 2 hard of hearing daughters. The cost after insurance was nearly $20,000. I am sick to death of insurance being a profit-driven scam. Whoa, okay. Well, when you've got 3 people in a household and everybody needs hearing aids, that's a problem. Do you have any thoughts on hearing coverage bills up for legislation? SB 62? Do you know about that? Okay. It says Menjivar and AL 224 Bonata. I guess that those are the legislators that brought it up. Alan, did you lose audio? Audio came back. Okay. So those are questions that came in on chat. Can you respond to any of those? Do you know anything about those bills? No, I'm not familiar with it either.
I have no idea.
Okay.
Maybe Google it. I'm not sure.
All right. So,
Did you have questions? I want to make sure I address your questions about United Healthcare. Have you been contacted by United Healthcare Hearing? Okay.
But I've been looking all over the internet, on Google, everything. You can buy them on Amazon. And it just gets more and more confusing. It's better just, I purchased my original hearing aids.
Okay.
And the ENT sent me to the audiologist. And now I have to get new hearing aids, a lost one. So, it's been a while anyway, since I've been using them and coming to Hearing Well Club. So, it's just, I was trying to save money because they're expensive.
They are.
But they have, I understand, the models have had higher technology, maybe 3 or 4 versions. So I'm trying to figure it out.
yeah, another business model that we haven't mentioned by name is Costco, because Costco is very popular And they have seemingly some advanced technologies in them, but it's a business model. And just like the VA, I have an audiologist I've known for 25 years. He's traveled all over the United States, and he worked for the VA a couple of years ago. And, you know, the VA, 20 minutes, appointments 20 minutes apart. And the servicemen get free hearing aids. They get the best ones, whatever they want, whatever. But the business model says how much time that they get. And that may not be enough. So I'm just saying every business model has restrictions, and you can't do very much about it.
One of the things, so very familiar with your situation and what you've ran into. One of the things that my company has done on behalf of both providers and patients is we've negotiated directly with the manufacturers to get a very similar product. So like the Oticon Real 1, it's last year's technology. It's typically what's going to be, you know, one of the top tier devices available on third parties that you can get like from United Healthcare Hearing, where you can purchase that directly from a clinic like Ann's and get their standard of care and cut out the third party. So it's just a patient to the private practice investment you're making directly with them. And you can get the same technology, very similar technology at the same price that you'd be paying out of pocket by going through United Healthcare Hearing. The big thing is you just want to communicate that with the provider, and they'll be able to go through options with you. Always recommend, you know, it's like if you were to get a hip replacement, would you want to get one where you walk like this, where, but you don't have any pain? Or would you want to be able to walk, but you've got pain? Or would you want to walk like this without pain? I mean, it's ultimately get what's best for you. It's worth the investment. It's going to give you the best communication with your loved ones, with your friends. You know, it's truly an investment into a better quality of life by going with some of that top tier technology versus going with some of the lower end technology.
I worked for the federal government for 27 years,
Mm-hmm.
and I had the Government Employee Hospital Association. And now I'm retired, and they were the United Healthcare. So after I retired, they told me I could get hearing aids, but they're the lower end, non-profound hearing loss.
Mm-hmm.
And I'm a hearing aid advocate. I was born hard of hearing all my life, and I've noticed all the hearing aids all my life, and so you can't pull a wool over my face. And I know the difference between them all. I've had all the brands,
Yeah.
all there, so I'm well educated, and so.
Mm-hmm.
But when they say they can't give you the high cost hearing aid, they only give you the base. And I asked, could I take the funds from that and pay for part of my hearing aid, and I'll pay the difference? And they said no.
Yeah, because that's the third party administrator.
That's the third party.
They're going through that third party, and you're limited to whatever's available through that plan. Yeah. So a manufacturer called Oticon, part of William DeMott, they took a stand on this. The Oticon Intent was their latest model that came out, and it came out like March? Yeah, about March last year. And they took a big stand, and they did not offer it on any of the third-party platforms because they truly believe in the private practice audiologists and making those purchases directly through the private practice audiologists. So you're limited to you're not going to get the highest end technology, the stuff that's going to make you most successful, going to allow you to hear in a loud restaurant or at a card game or at Thanksgiving dinner with your family when it gets loud. They really took a stand, and United Healthcare, when they pulled Oticon off of the entire platform because of that. And, you know, it hurt Oticon as a manufacturer, but they took a stand because they truly didn't believe that their latest model needed to be on there, and the providers would get low cost fitting fees, low reimbursement on that. It was a big deal in our industry.
Yeah, I wanted to say, no matter where you go, whether you go through a third-party provider or a private audiologist, there is a trial period, and you should always be aware, and you should get that information in writing of how many days, 30 days, 60 days. Some offices are different. Some people give more, some give less. What is the minimum by law? 25? 45 days. Okay. So whatever you do, make sure you're satisfied. If you're not satisfied, you have up to 45 days to return it and get any refunds that you get. And I just want to say for myself, I have a profound hearing loss. I would never survive with with true hearing. I would never. I made up a flyer here, and you're welcome to pick it up. A recommendation from the Hearing Loss Association, Mission Viejo Chapter, to always choose a patient-centered audiologist for your hearing health care, and ask for all the best practices testing, pure tones and bone conduction, speech reception, speech discrimination tests, quick SIN, which is basically speech and noise test. I have a lot of problems with background noise. You've got to have that test so that your aids can be adjusted for that as much as possible. Diagnostic testing for acoustic tumors and middle ear issues might be necessary, and auditory processing problems. So that might be called for. And real ear measurement. Somebody laughed at me. I told them, make sure you get real ear measurement. And that's a test that is done with your hearing aid in place, little tiny microphone. It tickles the middle of your ear, and the audiologist can see the impact of the sound going through and can verify that what you're hearing is the prescription that has been recommended, and adjustments for a telecoil, volume, all of that. It verifies the prescription. It's called real ear measurement, and any hearing aid provider should be able to use that test. It makes a difference, long-term, better outcome. So anyway, you can pick this up. I have the flyers over here.
If I can add one more thing, ultimately, the fact that you're going out and getting, hearing health care, that's a huge, big step, and it takes people a long time to, actually to make that step. So any step is better than no step. I'm just here to make sure, you ask these questions. So if you're going to see a provider and you're going through a third party, just ask the questions. Ask, what kind of testing are you doing? What does my treatment plan look like? What am I getting for this discount? And compare to what you would get if you were to purchase directly through the practice.
Okay. It's 3:00. Any other questions? I don't want to rush anybody out of here with who gets. Okay, so there's a comment here. I think your comments are biased against insurance covered hearing aids and do not take into consideration the economic limits. Many people with hearing loss. Also, all over-the-counter aids are inferior to prescription aids. I don't know if I'm reading that correctly.
Yep, you are.
We have people that got Anne, for example, got her hearing aids from Kaiser, and she's very happy. So just know what your trial period is. And if you don't think you're getting the best sound, the best quality, you have options.
So the bottom line is what we wanted to say today is you have options, like Tony just said. Check and see what your benefit pays. You think that you're getting a discount, but when you compare what your out-of-pocket cost is, you could get the same or better coverage for your out-of-pocket expense. That's what we're trying to say. Some insurance companies, the way you have your benefit, we can't compete. We'll say, you know what, you need to use your third party because you're going to get the hearing aid and it's going to be something that we can't compete with. But Tony has always said an educated person gets a better hearing experience. So make sure you shop around, find out what your out-of-pocket is and compare, because you might find we will say we have Costco priced hearing aids. We just don't have Costco quality. So we carry a better quality product. But again, you just have to be comfortable with where you're going and what you're getting. But just think, just because you have a discount plan doesn't mean that you have to utilize it and keep that benefit. That's what we're trying to say.
Okay. One more comment. Yeah, they wanted us to comment on Medicaid coverage. I don't have any. Do you have any comments about that, AJ?
I don't.
No. Nobody here has any experience with the Medicaid coverage, except that I would imagine that it has its own business model.
Medicaid and CalOptima are the same.
Medicaid, yeah. And CalOptima are the same. Right.
They're all finance based. So you have to go through them and there's a whole nother department that deals directly with them. And you have to be a CalOptima provider in order to get a CalOptima hearing aid.
Thank you very much. And Dr. Gabby, AJ, thank you so much for joining us today. And thank you all for coming. And I hope we'll see you next month to see the doctor from House Ear Clinic. And he has offices in Orange. The famous House Ear Clinic is in Los Angeles, but he works out of Orange. So you would hear what he has to say about any medical issues and sudden hearing loss. Okay, thank you. Yes.
Thank you for having me. Hey. Provider.
Thank you, Alan, and thank you, Joe. Bye-bye.